Mr. Ukash Ali Ahmad is Program Coordinator with Multicultural Communities Council of South Australia, here in Adelaide, South Australia. And he's also mental health first aid instructor and running around many of wellness and mental health and other health campaigns within the community for proper engagement, inclusiveness, and with diverse multicultural communities. Ukash, first of all, thank you very much for taking time out and letting us speak about these real issues of mental health within the wider culturally and linguistic diverse communities in South Australia.
Thank you so much, Brother Daljeet. It's a very important topic that we need to speak about, and obviously the multicultural communities are people who have predominantly arrived the last 2 or 3 decades to Australia, and a lot of us come from countries where the subject of mental health is a taboo.
And now, viewers, since you are here and Ukash is here, we would like to congratulate him because he is the recent winner of Men's Health Champion 2025 in Australia. Heartiest congratulations from our side.
Thank you, Brother Daljeet. Thank you so much.
So, Ukash, we'll start from first thing. As you know, the wellness, mental health matters a lot, especially when you see multicultural communities, wider immigrant community in South Australia. So since you are out within the community more with different programs and different communities like Indian, Nepalese, Pakistanis, we name it, and you are there out with the programs. So what you have observed as since you are in field of wellness and men's health, so what exactly you have noticed? Is there any gap within the community? Is there lack of awareness about mental health issues? So what's it is all about?
Look, it's a very good question, Brother Daljeet, and I'm glad you've asked that question. I've been in this space for a number of years now, and over the last 3 years or so, predominantly more interested in the mental health side of things.
Mm-hmm.
And one thing I've observed is people from culturally and linguistically diverse background kind of fall into the cracks when it comes to mental health related conversations. Obviously, they come from a very collectivist culture, and you come to a country that's a little bit, a culture a bit individualistic in nature, and the package they bring with them is, past traumas, culture, religious considerations. On top of that, it's the life transition that stresses people the most. That's one thing I observed. Parenting is massive.
Yeah.
And the intervention models out there is, you have to be in crisis to get the support you need in Australia. And that's not something that someone from core background will lean towards to. And most of the mainstream services, sometimes, not all of them, can sometimes miss the right engagement strategy with people from core background. Mm-hmm. And as a result, that becomes a deterrent on top of the stigma and all the other stuff that sits in it. So we've been, thanks to a very generous funding contribution from the Faithful Foundation, the last 3 years we've been really more interested in the prevention side of things, because there's really benefit in preventing crisis. And some of the programming we have done was to bring these people together for them to share their perspective pretty much on what mental health and well-being looks like for them. And a lot of them are just saying, look, they're going to be more connected as communities. They need to be well supported with that transition as well. And in the event that someone needs crisis intervention, the services have to be culturally.
So since you have suggested like what are the various programs that are being started already running, so as from the view of multicultural communities, the different age groups, because you have worked with youngsters, you have worked with different kind of like religious people, youth, elders within the community. So with these fellow Australians and immigrant community, how much you feel like which age group is more like concerned about it?
It's the young people. One thing I found is the young people who grew up in this country through their schooling and exposure to the Australian culture from a young age kind of have a way to speak about this thing a little bit more freely than the elder people. The cohort that struggles with the concept of seeking help or talking about it are the ones that, 40 plus, in my opinion, and that have come over the last 10 or 15 years to this country. And obviously, that's a lot. There's something that explains it, where they come from. I mean, people don't share their struggles as much. Like, it's part of life, just go and deal with it. And so they lean towards spirituality and culture as a shield. But that doesn't necessarily mean that, those things, those interventions sometimes may work for the individual. So when you add that to the complexity of someone coming in a society where, obviously they're new to the culture, they're new to the way of life, the environment is different, nutrition is different, the way of life is different, that sometimes puts there is a Punjabi or a Somali in the schools is an Aussie kid. So that's the problem. Yeah.
So, Ukash, we have seen there are many programs being run by MCCSA with support of South Australia government and other organizations to provide services or to provide an awareness about a couple of things. Like recently, I remember you have done one community consultation for the upcoming hub for health wellness hub, which is soon opening in South Australia in different areas of the town. And apart from that, you have done many consultations with Hindi speaking, Punjabi speaking, Nepali speaking, other languages speaking communities. So how is the help or what kind of awareness is available for those communities?
The most interesting observation I made first is support for people for culturally linguistically diverse background has been an afterthought in terms of policy and programming for many, many years. I see a genuine shift in that at least South Australian state level. Minister Chris Picton, who's the Minister for Health SA now, is using this language of prevention and trying to make sure that communities, there's no one size fit all, and communities now can access.
So prevention is better than
cure. So that's, for me, that gives me a bit of hope. And the work that we do with the Faithful Foundation as well, and trying to then champion that piece of work, is equally important as well. So for the community now, the thing is just, communities have to just organize themselves there are support that comes, and obviously now you will be working with us on the Taking Care of Me project, which in itself is like, giving men from poor background the edges to take control of their health and well-being in a way that makes sense to them, and social isolation and how we tackle that's a big part of it. Nutrition, physical health, emotional health, and well-being in general. So I think there's a general shift for communities now. A lot of the consultation is done through community, as opposed to before it used to be kind of tick box. There's a genuine shift in the way government thinks about this, and philanthropic communities are at the forefront of this. And it's too early, but I can see that embedded in programming as we go along. So, but the communities now have to just now start mobilizing themselves and be more connected. People like you who are community champions and constantly trying to find ways to connect men and take them on retreats and bring them together to give them the right information is a big part of it. Obviously, it's a complex social issue at the moment, and the system as it is better at dealing with crisis. That's where the funding used to go traditionally. But I do see a genuine shift. The establishment of Preventive Health SA as like a government, kind of like a department itself is a statement which we get in the funding that we're going to be using to implement the Taking Care of Me for the men only. But again, we have to deal with young issues, young people's issues, a lot of issues as a starting point. So I think there is hope, and I only hope that momentum continues, because there's real benefit in prevention.
So Ukash, like you have mentioned about one Taking Care of Me project. Viewers, this Taking Care of Me project has recently been consulted within the community, and the main focus is like how, and it's mainly focused on men's health. So how men can take care of themselves, because and especially from perspective of immigrant, more pressure is on whole family. But since we have already discussed with child, family, pressure comes on men as well. And normally it has been observed, men don't take it in further discussion to speak with someone if they are having any issues. So you have mentioned about Taking Care of Me project. So definitely will enable the wider communities to understand. So how you see in these 2 years for this project, like what shift will be within men of different communities, how open they can come up after these sessions?
The Taking Care of Me project is a 2-year kind of pilot project that builds on a previous work that we did with Faithful Foundation on the cultural and men's mental health community connected project, which was a mental health focus. Through that project, we have seen health is hope. People want to discuss mental health, but they want to discuss general factors that contribute, the physical aspect to your nutrition, sexual health and all that. So we'll be working with 6 communities, and the Punjabi, the Hindi speaking community, one of the 6 communities that are with us. And the consultation we did already highlighted the need for this program from men. They genuinely want to prioritize their health and well-being. They just wanted a clear intervention that works for them, a strategy that they can kind of resonate with. So the way the program is going to work now is the next 2 years through the funding from the Hospital Side Foundation Group, which was so generous in kind of giving us the initial funding, and Preventive Health SA complemented that funding for us to do work with 6 communities. What's going to build is we will be using the evidences that we develop through the programming that we do over the next 24 months, which the consultation was the genuine co-design was a big part of it. So the community tells us what they need. We have identified 4 health champions by each community. Those health champions will undergo quite a rigorous training over the next 4 to 8 weeks, and that training will give them the necessary tools to facilitate peer-led sessions, get the right information, the men's health checklist, and lead the health information that we call.
So it's giving information and taking information as a feedback from them as well.
Absolutely.
How the services can be
100%.
maintained in a proper way.
So the health champions will be the link between community and service providers. MCCSA will sit in that capacity building frame. So we're just connecting the dots. But it's really exciting because we're working, it's done in conjunction with the Abbott University, the Freemason Center for Men's Health and Wellbeing, Preventive Health SA, and the Hospital Research Foundation, a genuine partnership with the 6 community as well. It's community-led. So come January, the activities will start. Men will start meeting in safe and supportive spaces. The health champions will do a lot of health messaging, but a big focus will be well-being, overall well-being, sport health, walks, picnics, discussing family issues, and then bringing the right support whenever the
Connecting with the right opportunity they have.
Absolutely.
So, Ukash, since this Taking Care of Me project is focused on men, and as you have already mentioned, like there will be not only discussion primarily with general mental health, it will be more into well-being and wellness. And wellness can be your physical health, mental health, your emotional health, your sexual health, your spiritual, financial, so every aspect.
Yeah.
So it's a great opportunity. And apart from this, how do you see, because you go around within the communities, different communities, so what opportunities they lack in support of the services and how they can access those services if they need?
So the biggest observation I made over the last few there will be enough information out there for men to access, but more importantly, when they show up for this support, then yeah, they get what they need and not get disappointed. Because sometimes you need the size of service accessibility is another one, but the way the service applied as well is another thing. So hopefully more services will be trained there frontline responders to be culturally more intelligent, provide a lot of support in terms of language support, and break down information in a way that's easily accessible for community. So we will try our best to manage and
You're doing it.
identify where the right services are at the moment. But then it's just constantly push the system to come closer to the community. We don't expect the community to always be the ones adapting and adjusting. Services need to do the same as well. So, and that's the primary focus for us over the next 24 months.
So, Ukash, with this wellness hub, the health centers which were scheduled to open in future stage. So what currently is the level of that arrangement? So when we can expect those specialized wellness centers to open in other parts of South Australia?
So I do know the point, the one you're talking about, the head health, kids 0 to 12, and then the last information I had was it was going through tender process to see which support services will take the lead in the implementation in Australia. The exciting part is it's a national and state coordination together. So federal, the Commonwealth government, and
But surely it's on the way.
it's on the way. It's 100% on the way. So they would. I anticipate an announcement soon. There will be one in the north and one in the south, as you know. And yeah, so the idea is for it to become a place that people can easily walk into those support services, and it's just easily welcoming, and kids get the support they need, but also parents can also get the support they need. So
So look, this is the beauty of that project.
sense of identity attached to this beautiful country, and make sure that the resources that are allocated to communities are fully utilized. They're not based on the basis of we can't engage with this community because they don't show up and stuff like that. That people get what they need. Services are more accountable to the people they serve. In terms of the community, I think services will always only improve if people genuinely share their concern,
Open up.
and always come to these consultations, because there is that MCCSA were committed to be the bridge between community and funders and other service providers. But again, we don't hold the wisdom. I honestly don't hold that wisdom. It's the community.
This community.
So I take community message to them. So I'm just a messenger on both parties. So
Same way, Ukash, we can communicate to that community, and it's upon you now. What kind of services, what kind of changes you are looking forward, because community is growing, so the needs are. So you yourself have to be, so language should not be a barrier. Reach should not be a barrier. So now is the time to open up, to discuss, because until and unless we open up, we define what are the triggers or what are the causes and what are the restrictions, what are the stigmas which the community is facing and they are not sharing. Because until and unless we share the things, how we can put in form of some consultation to them and they can forward it to the government as well. So be updated. We will be bringing more episodes in this regard. And today we had this discussion in English with Ukash. So we will be having more information in wider different multicultural languages. Once again, Ukash, thank you very much.
Thanks.
We wish you all the best. Thank you very much for your time.
Thanks. It's an absolute pleasure. Thanks.